Time for StudyBuddy review. I will be reviewing the topic with you by asking you questions with pauses in between. It's like a virtual study buddy and flashcards for your ears. Okay, let's begin. Insulin. There are 4 types of insulin: rapid-acting, short-acting, intermediate-acting, and long-acting. What are some examples of rapid-acting insulin? Lispro, also known as Humalog, and Aspart, known as Novolog, are both rapid-acting insulin. What is the onset, peak time, and duration for rapid-acting insulin? Remember, onset is how long it takes the medication to work. The peak time is when the medication reaches its maximum effect, and duration is how long it stays in the body. As the name suggests, Lispro and Aspart are rapid-acting, so they have a super fast onset time of 15 minutes and a peak time at 1 hour, and it lasts for 3 hours in the body. When should rapid-acting insulin be given? That's right. Because of the rapid onset, always make sure the meal is ready or will be ready within 15 minutes before giving Lispro and Aspart to prevent hypoglycemia. Next, we have the short-acting insulin. What are some examples of that? Short-acting insulin include regular insulin, also known as Humulin R and Novolin R. What is the onset, peak, and duration for regular insulin? Yes, regular insulin has an onset of 30 minutes and peaks at 2 hours and lasts for 8 hours, so make sure to give regular insulin within half an hour before meals. What are some examples of intermediate-acting insulin and its onset, peak, and duration? That's right. NPH, such as Humulin N and Novolin N, are intermediate-acting. NPH has an onset of 2 hours, peaks at 6 hours, and lasts for up to 16 hours. Because of that, it is usually given once or twice a day, and it is not as important to take with meals, but instead, it should be taken at the same time each day. And lastly, we have long-acting insulin. What are some examples and the onset, peak, and duration? Long-acting insulin include Glargine and Detamir. Long-act insulin works slowly and steadily in the body, so it does not have a peak time, and it starts to work in 3 to 4 hours and can last for up to 24 hours. It is usually given once a day. Intermediate and long-acting insulin are often used together with rapid and short-acting insulin. Okay, let's review the onset and peak time for each type because it is commonly tested on NCLEX. The onset for rapid-acting and short-acting is 15 minutes and 30 minutes, so make sure meals will be ready by that time. And intermediate and long-acting start to work in 2 hours and 4 hours, respectively. So remember, the onset for each type is 15 minutes, 30 minutes, 2 hours, and 4 hours. It is also important to know the peak time because that is when patients are most at risk for hypoglycemia. The peak time for each type respectively is 1 hour, 2 hours, 6 hours, and how many hours for the long-acting? None. There is no peak time for long-acting. Okay, now that we've memorized the types of insulin, let's talk about some unique features for each type. For example, which insulin can be given intravenously? That's right. Regular insulin is the only insulin that can be given intravenously, and it is usually indicated for DKA and hyperkalemia or elevated potassium in hospital settings. Otherwise, it is given as a subcutaneous injection, just like other types of insulin for blood glucose control. Which insulin is cloudy in appearance? Yes, NPH, which is intermediate acting, appears cloudy due to an ingredient called protamine. Make sure to rotate the vial before drawing. Since NPH is cloudy, do you think it is safe to mix with other types of insulin which are clear in appearance? Yes, it is safe to mix, but it has to be done in a particular way. Clear insulin should be drawn before cloudy insulin to avoid contaminating the clear vial. So remember, clear before cloudy, which means Lispro, Aspart, or regular insulin before NPH. What about long-acting insulin? Can it be mixed? No, long-acting insulin should never be mixed with other insulin. Remember, no peak time and no mixing for long-acting. Lastly, let's briefly talk about insulin administration before ending the video. As we all know, insulin is given as subcutaneous injections into fat tissues right under the skin. What are some common sites for sub-EQ injections? That's right. Common sites include abdominal tissue, under the arms, and anterior and lateral side of the thighs. Sites should be rotated with each injection. Can you tell me why? Rotating injection sites help to prevent scar tissue from forming, which happens when the same spot is used repeatedly. For the same reason, avoid injecting into scars, bruises, or open skin. After injection, what should be avoided so it does not increase absorption rate? Avoid heat, massage, and exercise of the injected area, which can increase absorption rate. You did a great job. Like and comment if you want to see more StudyBuddy series. See you next time.